Welcome to the Emerging Minds podcast.
Hi everyone, my name is Jackie Lee and you're listening to the Emerging Minds podcast. As we begin today's episode, I'd like to acknowledge the traditional custodians of the lands on which this podcast is being recorded, the Kaurna people of the Adelaide Plains, and pay my respect to the elders past, present and emerging from the many First Nations across this beautiful country. We acknowledge that sovereignty was never ceded, that this always was and always will be Aboriginal land. In 2025, Emerging Minds celebrated 30 years of advancing the mental health and wellbeing of infants, children, young people and their families. So, for this final episode of the year, we thought we'd take a moment to reflect on how things have changed in that time and how the insights gathered over the past 3 decades can guide us towards even greater outcomes in the years to come. And who better to take us on this journey than Emerging Minds Chair and Founder Phil Robinson and Director Brad Morgan. Welcome Phil, welcome Brad. Thank you so much for joining us today. Phil, I'll start with you. Can you take us back to the early days of Emerging Minds and ACAFMA as it was known before then? What did you see as the priorities for children's mental health when the association was first formed?
Well, I think in those early days, in the, say, mid-90s, most of the focus was on adult mental health. And so there wasn't the same sort of national focus on children, infant children and adolescents. And so what I did was then convene a conference here in Adelaide in 1995, and it was actually called From Rhetoric to Reality. Why we called it From Rhetoric to Reality was that there was a lot of commentary around the idea of promotion, prevention, early intervention, but in fact, the majority of the money went into the adult mental health sector. And so it was really at that point to sort of wave a flag and say it's important that we have that opportunity to focus on the needs of infant children and adolescents and their families. And one of the things that came from that was that, in fact, the Commonwealth, and I'll have to hand it to them, they actually said to me, if we're going to give you some money to run this conference, it actually needs to be co-designed with families. And in fact, I don't think the word co-design was even invented then. But what we did was, from that very day, work with families in regard to that partnership. And the other component that I think had never happened before was that all allied health professionals were able to come together as part of that conference. There'd never been a conference on child adolescent mental health which focused on all of our partners. It had been very much along the lines of probably child psychiatrists who would have these conferences, but never had there been one for allied health professionals and their families.
Yeah, right. And so, Brad, how do those priorities look today? Have we managed to move from rhetoric into reality, do you think?
I'd certainly say the same core principles and functions and challenges are actually still the same. I think I'd say there's been progress in some areas and areas where we haven't made as much progress. So I think when I think about groups that come together now around children and young people's mental health, is those groups, it's actually normal and natural to expect to be part of a multidisciplinary shared experience. Learning about this and working on that, that's actually something that has changed. I think some of the other areas that maybe haven't had as much change yet is getting the balance right with our emphasis on what needs we're focusing on in relation to infants and children and young people. So quite often we are still talking about the crisis, which is still a very big and important focus for us, but it's maybe not as balanced with how we're addressing and supporting mental health promotion or prevention and early support still within that population. So the balance, I'd say, is still something we have to really actively work on in our work.
Yeah, so would it be fair to say that one of the most urgent needs now is possibly similar to what it was 30 years ago, which was that real focus and implementation of prevention and early intervention initiatives?
Definitely. And I think the other bit is ensuring that we still maintain visibility on the unique needs of infants, children and young people. I think we can still get trapped into just thinking about what adults need and not viewing adults even themselves as part of families or parents or connected with children. And so that separate element is still something we've got to work on and continue to work on. And certainly there's work that is progressing in that area, but it's going to take some time and a lot of effort from systems to deliberately support that to be an expectation. I think at the moment I'd sort of say we have really strong pockets of examples of this, but it's not unified and it's not national. And as a consequence, families don't experience probably a wraparound that we would like to see.
I mean, there's something in that as well, right? Is interventions and approaches that focus on the family as a unit opposed to just prioritising individuals, whether it is individual children or individual adults, approaches that support families as a whole.
Well, I think Phil will probably comment on this, but certainly the foundation of work that's always been in infant-child mental health has been a very strong emphasis on the family as a focus for support. You know, I think that's just a developmental lens you always have in this space, and I think anyone who works in this field would recognise that. There's challenges in that as well, but that is something that the system has and continues to struggle to respond to. And Phil, you probably could comment a bit more on the early days of that as well.
Yeah, well, I think exactly part of the work I think that we have been doing is setting up frameworks for health practitioners as well and other practitioners that are working with children, infants and families as to what is required in terms of that level of support. So I think certainly one of the things that we did in the early days was a framework in the area of children and parents and mental illness. And so that was in fact led on to our second conference. One of the things that struck me was that there were pockets of good work going on all around Australia, but it wasn't actually brought together. And so that was where we then started developing our own manuals and documents on that, so that instead of everyone developing their own at each jurisdictional level, we were then able to put something together at a national level. And I think if I just focus on that for a minute about the COPME, one of the things that really, I think, one of our cornerstones has always been working with families, working in partnership, not developing materials in isolation from the families. And I think the test of that was that when we produced the various documents on COPME, it was universally accepted by health professionals and families as well. So we didn't have that situation where something had been parachuted from the sky and people thought, what is this? It had been something that had been worked out in a collaborative fashion. And I think that's one of the hallmarks of this organisation from 1995, 30 years ago to this very day, working in partnership, not only with our families, but also with other health professionals and other professionals or people that work in this sector. So I think what we're trying to do is get a common understanding across all of those sectors about the importance of infant, child, adolescent and family mental health.
That leads me beautifully into my next question, which was, how has the understanding of infant, child and family mental health evolved over the past 30 years?
Well, I think there was a lot of theory that was available, but I think one of the issues was there was a disconnect between some of the theory that was available in terms of promotion prevention literature and then implementation. And so I think we can look back into the late 90s when Professor Beverly Raphael had the National Mental Health Promotion Prevention Action Working Party, and she produced a document then, which I know I was talking to Brad about this the other day, I think he still uses it. It's still a Bible that was produced all those years ago, which actually talked about risk factors, protective factors for this population. And one of the things I think that was missing at that point in time was implementation. So in other words, we had a lot of theory around how some of this could work, but a lot of it was then not implemented and not translated. And I think that's one of the joys that I can see looking back over 30 years as to where we came from and to where we are now. So I think it gives me a great deal of pleasure to see the materials that we now have developed, which are accessible and universally accepted. We've got very good data now on the number of people that are actually accessing that sort of information. And I think for me, that's one of the huge things that has actually changed. We've gone from rhetoric to reality. Rhetoric being, we've got all these ideas, but how do you implement them? And I think the other issue we're doing within this organisation now is spreading that information out across a wide sector.
Where did prevention, early intervention and collaboration fit in during those early years of...
Well, as I said, I think there was a lot of material that was being developed in regard to the promotion, prevention, early intervention. But the problem was that the investment of dollars was in the adult sector. So I think back then you probably were getting I can think of in child adolescent mental health, for example, we're probably getting 7% of the mental health dollar to service 30% of the population. So that's really where that whole theme of rhetoric reality came in, because really what we would see was that there was a great need to be able to develop these early intervention programs. There was a lot of data to say that it would be appropriate to do, but there was no money to do it. And so I suppose at the end of the day, that was really the key, one of the key drivers about getting a CAFMA formed. In the end, the Commonwealth gave us money to actually set up an association. And so that meant that we were actually then moving into the business of, well, how do we translate this particular bit of information in promotion prevention and implement it? And so one of the earlier works we did was, of course, the children and parents of mental illness. We were able to identify the needs of that population, and then from there we were funded by the Commonwealth to actually implement some of those principles in terms of materials that were available. And so that was where we got into developing our earlier websites with COPME, and that material then, whilst the Commonwealth funded it for Australia, it actually became international. And I think what that said to me was that in fact there wasn't anywhere else in the world that was actually translating that sort of work into something that people could use. And so there was like this theoretical component, but it was then not getting into a translational component. And I think that was probably the key.
And so, Brad, what does that look like today, and how can we scale and strengthen these approaches nationally?
We've got a really strong emphasis on youth mental health now, and we've seen that support and wraparound growing. And that's been a representation that other countries have adopted as well. And I think that's something that's really strong. I think something that we are aware of and where a lot of our energy and attention is focused on now is actually supporting younger people, so infants and children. And there's a really strong opportunity and missed opportunity to really grow and support that population in Australia to be able to have access to the resources, and their families to have access to the resources that support their mental health so that they can develop and thrive. And I think part of our work is to raise awareness of the needs. I think we still have a bit of work to do just to help people see that infants and children do have mental health as well, and it's actually something that's really important and a foundation for their lifelong health and development. But also recognising that a lot of infants and children actually are struggling with significant mental health challenges as well, and they actually need more intensive wraparound as well. And that's something I think we are starting to get better literacy on in the community, but needs a bit more effort. And we do have some evidence of policies and things like that going into place, but I think, as probably Phil mentioned, there's a lot of frameworks and a lot of documents. The real challenge is implementation and making sure that it's actually funded, that's sustainable funded as well. I think that's one of the challenges we have in this area I mentioned before around there's lots of programs and lots of things that families can access, but without sustainable funding and organisation of that, we will struggle to really meet the wraparound support needs that those children and families have.
Phil, you've mentioned Beverly Raphael. What other early models or developments gave you confidence that the field was moving forward? And how did you begin to bring in the voices of children, young people and families?
I think if I go back to, say, the first or second National Mental Health Plan, I was at a workshop in Sydney, which Professor Harvey Whiteford was facilitating, and there was about 300 people in there, and someone held their hand up and said, well, what about infants, children and adolescents? And he pointed to me and he said, that's why Phil's here. And so that was, I think that's actually an important message, because that was like 300 people and one of me. And so I think that illustrates, and positive to me, because what it's saying is from where we started, we've gained a significant prominence now in regard to the whole area. And I think by doing that, that makes a huge impact on policy. It also brings people together. And I think one of the other hallmarks that we've been working on in this organisation is how do we showcase great work, how do we build on that great work rather than reinventing the wheel where it's there. So I think we're able to, through our connections, and we've got a very wide connection now across the sector, I think that puts us in good stead to be able to, again, in the way we started at the beginning, about collaborating rather than telling people what to do, working in collaboration with our partners.
And so, Brad, what are the most promising models that you see today, and what policy or structural changes are needed to support them?
That's a big question. I'd say some of the really promising opportunities and models I think we're starting to see internationally, but also locally as well, is these ideas of wraparound and systems of care that can provide support to families. It recognises children and their parents or their other family members aren't isolated from each other's needs. They actually interact with each other and have an influence in each other. And so where I sort of have a very strong interest is in how do we set up structures that are very much focused on wrapping around the whole family and the family's needs and the connections of those needs, not just mental health, but with other social health, cultural needs that sit within families. So I think there's opportunities and examples, but I think within Australia we obviously need the governance structures and the systems to enable that practice, and I think that's something we hear a lot from workforce and from families. There's a desire, there's a need for this, there's even evidence and strategies and frameworks to do this, but unfortunately we don't have necessarily the organising structures or funding structures that enable that and make it easier for that to happen. In fact, I think a lot of people talk about it actually prevents them from doing that type of work that they know is needed and works for families. So there's always going to be a bit of work for us and a lot of our collaborators and partners to help tell that story. And I think that's sort of one of the challenges I think at the moment in a lot of the work is because of the short-term nature of funding in a lot of areas of work is there's a lot of competition for those resources and small resources as well. And so while that's there, it's going to be really hard to organise and coordinate those systems and services. And so that's really a responsibility of government to be able to look at funding, but also organising those services and frameworks so that it isn't a competition between this service or this service is available to families. It's actually both services are equally important, but we need some way to fund and organise them so that families do get that wraparound support. So I think there is a lot of work to do. We do have some promising steps. I think, having a national children's mental health and wellbeing strategy is a really important document for us to be able to lever off of. That's actually describes an intention from government to do that wraparound, to focus the attention on this population. That I think as a sector, and I think us as an organisation, but also other partners in this, is how do we collectively communicate this idea of a wraparound need, that we don't just focus on what we can offer and what our services can do, because they're all valuable contributions. But I think it's actually how do those collectively present themselves so that we can do the full wraparound that's needed for families, so they're not having to navigate and find or miss out, I guess, is sort of in those areas.
Yeah, I'm curious to know, and I'm not sure if you know the answer to this, but the places around the world that are doing that wraparound care well, do their governments move in the same sort of short-term cycles as ours do? Because I'm wondering how we can get longer funding cycles when the governments who are signing off on those are also seemingly focused on 4-year terms.
I think that's a global challenge.
Yeah.
And I don't think there's any country I would go, you're doing all of the things have aligned and it's all perfectly delivered. Like, I think each country has its own challenge, and I think Australia has actually showed really tremendous leadership in a lot of the work that's been done. I think we're one of the only countries that actually has a dedicated strategy for children, for example, and their mental health. So I think Australia has demonstrated leadership, but I think Australia has unique challenges in the way our governments operate and the different roles that both the Commonwealth and the different states and territories have in negotiating those. I think there's lots of reviews that have demonstrated the challenges, and the governments themselves are very well aware of what those challenges are as well. So I think in our unique context, I think our problems aren't unique is how I'll describe it. Everyone I speak to, every country with similar programs to ours and organisations say they've got the exact same challenges of we can see where it works and works really well, and it's always in little pockets, but we've always struggled to scale up at a national level, and there's many reasons for that. Some of that's financial and funding, some of that's the way it's organised, but some of it's just really pragmatic challenges of we just can't get workers, we can't get the services we need. Some communities are still struggling with basic infrastructure and technology. Like, it's sort of, there's some really big other challenges that get in the way, and that's where we do need that national leadership, I think, in that area. And I think technology, people, governance, and ensuring that families are actually involved in those elements as well, like they're all really important features that we know contribute to good systems, but they require effort, they require leadership, and they require resourcing to enable that to happen. I think something we've discovered, and we connected with a lot of rural communities and things like that as well in our work, and there's such unique needs in every community. I will always remember a quote that came from that work is, if you know one rural community, you know one rural community. And so we really need like national organising frameworks and structures, but it also needs to be flexible enough that local communities and the local culture that's reflected in that community can actually take those ideas and frameworks, but actually make them work in their community so that it best meets their needs. So that requires effort as well, and leadership at a local level. If I think about what's needed is, national leadership and frameworks and tools and resources enable that, but also local leadership that enables that to be implemented.
And a joint approach by both of those leadership.
Yeah, well, definitely. I think for that to work requires really good relationships and trust between the local and the national or state and territories as well to enable that to happen. So
the other thing that I would like to say is really that the Commonwealth in Australia has been incredibly positive about working with us, and it's been in a bipartisan way over 30 years. So I think that's really, very important to call that out, because I think what we've also seen is that, say, for example, with the work of COPME, we were recognised around the world as the leader. I used to chair an advisory committee that brought all the world leaders together. But what they always said was that our work, they actually were using our work. So whether it be in America or in European Union or in London or wherever it was, they were using our resources. New Zealand was using them. And I guess we're very grateful that the Commonwealth have seen fit to continue to fund us in that way. And I think that without that funding in a way forwarded to us, then a lot of this wouldn't have been able to happen. And hopefully it'll continue into a more permanent funding in the future, because what I think we can see, looking back 30 years, is the needs are still there. Some of those needs are still today. Like I was struck by Brian Burnican, who was the Human Rights Commissioner, wrote a very central document on rural mental health. And one of the statements he made in there was that where the needs were greatest in some of these remote communities, the resources were least. And really struck me recently when I was looking at our report in regard to workforce, almost the same words were in that report. And so I think, while we've made progress over 30 years in some areas, there are some endemic problems that still remain. And therefore, it behoves us to figure out, well, how do we address some of those needs? And I think we're moving in a very positive direction with the Commonwealth so that we can look at hopefully a longer term funding, which then means that a lot of our strategic thinking, a lot of the work that we're doing then has a longer trajectory, and it means that we can plan in a deeper way. So they're the sort of things that I think we need to be aiming for, so that this organisation then is not on a 4-year cycle or whatever funding cycle. It then becomes part of the landscape of mental health, so that we're actually it's sitting there and it's achieving the work that we are able to deliver. And I think that, for me, is what I feel most proud about, that we are actually delivering the work, and incrementally it's improving just so much. Like if you think back 30 years ago, I built the website on the weekends. I had a staff member that worked half a day a week. That was it. And now we look at the level of sophistication that we've got, whether it be with our web technology, our podcasting, our videos, all of that technology is at a very highly sophisticated level. So the organisation has developed a whole range of skills to actually be able to apply to this area. And that's been, I think, incredible, and related to the fact that we're getting that stable funding, where we've then become much more sophisticated in terms of what we've been able to deliver.
And Brad, looking forward, what are the biggest challenges that you see now, and what are your hopes for Australia's infants, children and families?
Well, I think probably the biggest hope I have is that we are able to support any child, no matter where they live, to have access, and their families to have access to the resources and supports they need for their mental health, which is positive, good mental health, but also when things happen or when they're struggling, is that those supports are there. And at the moment, addressing those issues, if it depends on where you live, determines whether you have access to some of those things. So that would be an important goal I think we need to address, is those issues of equity, really. The other bit I'm conscious of in the work, and I think this is aligned with sort of our movement, particularly with digital and also AI moving into the future as well, really important opportunities that exist within those to, scale up supports that maybe we haven't been able to scale up and grant access to those. But I think a certain part of that I think we won't get is that connection. And I think that was at the foundation of the organisation's history, is bringing people together for that connection. And I think that's what's needed for us internally as an organisation to help. What is our role in supporting those connections and providing those places that enable that connection between different workforces and families and researchers in that place? But I think alongside of that is recognising that's also what children and families need as well, is finding places for connection in their communities and addressing some of those issues which we know are getting in the way of that for a lot of people and children and families. And so I guess within infant and child and adolescent family mental health, we know that relationships, that the quality of those relationships that children have are really what shape their mental health now and into the future. And so finding and protecting that, I think, is going to be a really important part of the work as well moving forward.
Thank you both so much. It's been a pleasure to speak with you, and I don't know about the listeners, but I feel excited and hopeful for where we're heading as an organisation and as a sector as well.
Thank you.
Thanks for listening. We'll be back in your feeds on the 6th of January, talking with Dr. Billy Garvey about resilience, emotion regulation, and the importance of understanding the emotions behind a child's behaviour. In the meantime, we wish you and your loved ones a safe and happy festive season and start to the new year.
Visit our website today at emergingminds.com.au to access a range of resources to assist your practice. Brought to you by the National Workforce Centre for Child Mental Health, led by Emerging Minds, the centre is funded by the Australian Government Department of Health, Disability and Ageing under the National Support for Child and Youth Mental Health Program.